welcome back to Movement Matters, a show designed to bring you the best physical therapy tips and exercises to decrease pain and get you back to doing what you love. I'm your host, Christine Lynders, board certified orthopedic physical therapy specialist. Today, we're going to gain an emergency room physician's perspective on everything from thought processes for the emergency room visit and what to do to stay healthy after that ER wake-up call. You see, the habits we have today, compounded over 10 years, let's say, predict the quality of our future health and well-being. You'll gain an insider's look into how the emergency room doctor's snapshot view of you can literally predict your future. Let me introduce Dr. Bill Linders in Chile, Connecticut, who's been practicing emergency medicine for 30 years. Welcome, Bill.
Hey, thanks for having me on your show.
Oh my gosh, thanks for coming on. It's so fantastic. So I'm so grateful to have you, A, because I get to see you, because I've missed you, and I love to talk to you and everyone else. But also, we chatted last week, and you said something to me that I have been telling my patients, not even all week long. I've been telling them the last couple of days of the week, and that's when you said to me, I was asking about emergency room
Mhm.
and you having this thought process, and you said that you say oftentimes to your patients in the ER that this is going to sound weird, but I can see your future.
Yeah.
And if whatever behavior or habit or something that they're doing that you see when they're there, maybe not why they're there, but when you review their symptoms, is predicting what they're going to be like in the future. Can you talk a little bit about that? I like that was so impactful for me.
Yeah. Well, not everybody. There's certain patients will come in and they present in a way, and I feel like my role in the emergency department is folks come in and they don't know me, but they're in a situation that's they're anxious, and I'm an expert in my field and they want my advice, and I think I should tell them what I think, and if I have some insight on their particular presentation based on my experience and my exposure to different educational things over my life. And so some folks, they present a way that I can say to them with a certain amount of confidence that I can see your future. If you continue to go down this path, I can tell you with some certainty what's going to happen. And you have an opportunity right now to go a different path. And I can tell you what that'll be like. And sometimes that's a moment you where you can change a person. There are these opportunities where people are at crossroads sometimes, and in the emergency department we have a lot of crossroads.
Yeah.
Um, and I feel that I should take advantage of that situation in that person's life to just make it clear for them. Sometimes, and this, your parents can be telling you something all your life, you don't listen to them, and then a perfect stranger tells you the exact same thing, and you're, wow, that's a good idea. And so sometimes that's my role, I think.
I think that's great. It's that epiphany moment, the thing that you wish you could bottle, right? When people
Right.
want to lose weight, they want to lose weight, they want to lose weight, and all of a sudden one day they wake up and who knows what it was? It could have been something somebody said or something they saw, and they go and they're like, "That's enough. I want to lose weight,"
Yeah.
or "You want to
Yeah.
stop
Yeah.
that bad habit." Where I
Yeah.
related it to physical therapy in my mind when I was talking to my mom yesterday, I was like, I just is so impactful, and I said it's the same thing when someone comes into my office and I see them slouching all day long and they're here for, let's say, whatever, bunion pain, and I see them
Mhm.
slouching, I can't help but tell them, listen, I know you're here for your foot, but you're slouching right here, and I don't know if you know anybody with neck or back pain, but this is what your normal spine is supposed to look like, and if you keep sitting like this, I guarantee you're going to have neck or back pain, or if you walk with your foot turned out, you're going to have degenerative joint disease in that knee because you get rotational stretches. And like you said, I love that you're going down a bad path and you have the opportunity, the blessing to change it now. They end up in the ER for one reason or another. Who knows? They could have broke their leg, and you review their symptoms and you see something that you can, like you said, you feel like it's the opportunity for you to tell them what you see.
Yeah. Yeah. We have a very impressive ability to live in denial. We can, it's a human trait, and it's amazing. And there's certain times where that can crack, and if you take advantage of it, you can just break it down and get these people on a better road. Um, so anyway, I try to help people in that way.
I love it. The live in
Yeah.
denial. So So I also alluded to you as the doctor house because when my dad was in the hospital and I called you with some questions, as I think our brains work the same with this bigger thought press, like into honing in. I think that's something that we have in common and from our dads and our moms. And I remember asking you questions and I was like, I like how Bill thinks. You know what I mean? I feel like that's kind of where my brain is going. So it's so easy to talk to you about things. So what do you do? Like, what's your thought process when someone comes into the ER for I don't even know what? Where does your brain go? If I don't know. Tell me.
All right. Well, there's
A bit of a
my training initially was in family practice, and I started off my career doing that. But at the same time, I immediately was doing emergency medicine work up in Maine, and I had worked on an ambulance in college and in medical school. So I always had that kind of a background. In both of those fields, more than any other, is a very broad training program. So we have the ability to work with patients throughout the spectrum of age, from just newborns, pregnant women, to the elderly population, nursing home populations, trauma. And so it's a wide a spectrum of a knowledge base. No, it's not super in depth in any of those areas. I mean, you have your specialists in certain components of it, but we have a wide breadth of comfort. And sometimes that allows you to see patterns that a subspecialist might not notice. And we can pull things from different areas and make more sense out of it. And I don't have so many knowledge gaps that I can. It's easier for me to see better in the relationships of things. For instance, both of my specialties in family practice and emergency medicine, psychiatric care is a big component of addiction medicine, sports medicine, and so some of these things can be applied to a person who's presenting in another area, and you can help, pull information out from them, say, this is something you need to think about. So we have that bigger knowledge base, but particularly in the emergency department, I try to focus on what I think is the most important part for them, and try to get rid of all the noise around them, and help them say, okay, this is what you need to do. Maybe this one thing or these two things are really important for you right now, and you need to go forward and focus on this. And then the other part that's unique for us is that we understand the system. We understand, all right, this is the reality of the healthcare situation for you in your particular case, and either your insurance or your limited insurance, the specialty arrangement in our community. Some certain specialties might have more representation than others. And so we can, and frequently we're talking with family, so we can understand their home situation, their resources to fall back on. And you pull all that together and you can say to a person, okay, this is your two problems. This is what I want you to do. I want you to contact these people, and you can go through a couple steps. So it's an opportunity to focus people, and it requires some synthesization of a lot of data points. And so that's what emergency room doctors do, and family practice doctors do, and providers, and
That's good. It's a great look, and you're potentially seeing them on one of their worst days, right?
yeah.
One of their worst days. So I have to ask you something. Since we're talking about that, we were chatting about aging, and I know our parents are aging, and it's a big concern for us. And we were talking a little bit about some perspective on helping them to stay at home longer versus being in the system. Do you have any thoughts on or any ideas for that? How to keep elder people able to be staying in their home versus going into care facilities?
Yeah, that's it's a really important for them. It's not only in terms of their being their depression. You can if you're looking at going into a nursing home, it's a lot different than your normal situation, and um, you have the comfort of your own home, the closeness to your family members. Like, not right now, I'm not sure how many people realize this unless they have folks in nursing homes, but with COVID, you can't see those folks. And so if my dad went into a nursing home, my mom is not going to be able to see my dad. maybe through a window if she happens to have a room where she can stand but look through it. I mean, that's what I've heard stories of that are just really sad. I mean, I had a patient a couple months ago. She hadn't seen her husband in months. This is the first time that I allowed her to go into the emergency department because she hadn't seen him for a long time.
Yeah.
And he was upset. He stopped eating because he was in the nursing home, and he was just getting sicker and sicker. And it all had to do with some of these family dynamics. So it's very important, I think, to a person's their mood if they can continue with their current lifestyle at home. And people don't understand how important it is with their decision making that they can, with the common thing is a fall. I see a lot of people with falls, and a fall say results in a hip fracture. That's a nursing home placement. And whenever you get into a nursing home, you really have about a 50-50 chance of not getting out of that nursing home, of just staying there. It's really, the numbers aren't really great. So it's important that you don't fall and don't break your hip and avoid that whole process. And in your career how what features are important to that. And so if you don't understand that a fall will be a life-changing event, you don't give it your decisions the weight. For instance, not drinking properly. I see a ton of older folks do not drink enough water. And if you don't have your pipes filled with fluid and you change position, you're not going to have blood go into your head. You're going to feel dizzy. You already have an incapacitated musculoskeletal system that has slower reflexes and less proprioception and less strength, less vision, all these things that set us up for falls. And then you take the blood out of your brain, all right, and you're going to fall. And so many of these falls are related to not drinking. So one of the things I did with my dad, who was prone to this problem, was I said, all right, we calculated how much fluid he needs to drink in a day. And I told my mom, fill the pitcher up every day. You put it on the counter, and all his drinks come out of that pitcher. If he has a cup of juice or something like that, you just take that proportional amount of water out of the pitcher and throw it down the drain if he drinks something else out of that pitcher. But by the end of the day, you need to finish that pitcher. And then when you're at the end of the day and you say, "Oof, there's a lot of water still in that pitcher," well, you can say to yourself, I got lucky today. I didn't fall and break my hip and go to a nursing home. All right. So it's something when, my dad calls up not too long ago, he's feeling a little bit dizzy. I say, well, how much water did you drink? How's the pitcher doing? And my mom can say, no, he wouldn't drink the water today. He's not. And so it makes it it takes a nebulous discussion about fluids and makes it very concrete. Hey, you need this amount of fluid. And so anyway, I thought that was a very nice way of at least getting a handle on one of the things that leads to a fall. And there's so many other things that.
I mean, that's brilliant though. That's brilliant because so many people fall, and you're talking about blood volume.
Right.
Blood volume contributing. Like, I've had a patient that came in the other day, and her blood pressure was so low. And the first thing I asked her daughter, did she drink any water today? And so we had her drink like 3 little mini cups of water while we were doing just a little bit of exercise, sitting, and it started to rise. And she said, I never really thought about that. And I think that's huge because, we're always harping on older people, drink some water. I know, drink some water. You might not be thirsty, you're less mobile, but our body is, what is it, 90%, 80% water?
I know. Well, you get these, older folks, they have, less capacity. Their blood vessels are kind of, narrow or harder. The blood flow is just in the body is limited, and when you take the volume out of it, just causes more problems. And so the other part of that's interesting with dehydration, I don't want to go too much on this, but so if you're not passing out, your brain might not be functioning as well, and you may be forgetting to take your meds properly, or maybe you took your meds in the morning, then you take them again in the afternoon. How many times I've seen that? It's surprising the amount of medications these older folks have. They have a dozen medications. I can't even take 1 or 2 medications. If I'm on antibiotics, I'm always forgetting my antibiotics. I don't know how these people do it when they have 12 meds. And then if you're getting a little bit fuzzy in your brain because you're dehydrated, just not thinking, your memory's off. So you throw that on top of your dehydration as you're taking, you doubled up on your blood pressure medications today. You're definitely going to go for a fall. Or you're not draining your bladder, so you get a urinary tract infection because there's no water flushing through your bladder. I mean, I could go on and on. If we just drank enough fluid, we could we'd put people like me out of business in the emergency room with just hydration, you know?
Here, hold on a second.
I'm getting thirsty too.
Let me get a sip. Well, no, this is so great because I mentioned the UTIs because I had heard a statistic years ago, I don't know, the number X, the high, like in the top 5, let's say, room for emergency room visits for hospital admissions. It was like UTIs
Right,
or something.
right.
I don't know if you know the stat, but I remember hearing that. I was working in the
Yeah.
hospital. I was telling my patient the other day, drink water because you need to flush like what you said. And UTIs, you get confused, you get disoriented, and then you're in the hospital and they don't know why. What's happening? It's just because of
Yeah,
lack
yeah, 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 yeah,
of
yeah, yeah. Yeah.
flavored
The other
water.
thing I think I talked with you about this the other day that I find impressive, and this is with my dad, is he was talking about how he's not getting any stronger. He's doing his exercise. Remember that? And he's
Yeah.
not getting any stronger. I said, Dad, you're not getting any weaker. That's the important part. You've maintained your strength despite you've aged 5 years, you've had a lot of medical problems going on, and you're still living at home. You're getting by. That's like huge. I think he started thinking, oh, you're right. I'm not going to necessarily be, you know, adding extra weight or miles onto a jog. No, it's just a matter of staying upright and getting up out of your chair by yourself and being able to walk to the bathroom, be able to change. Those are important activities of daily living. If you can't do that, you need a nurse in your home or you need to go to a nursing home. Or you have your spouse try to help you do those things and you throw the back out of your wife who's trying to pull you out of the chair because she shouldn't be lifting a person like you at her age. So it's I was surprised that he said that, and I'm glad he said that because I didn't realize that was going through his brain. But he had been doing a good job with his exercises, which is hugely important. And it doesn't, this, it doesn't take a lot. It just needs to be a continuous, repetitive pattern.
Say that again.
It doesn't need to be a lot, just a continuous pattern.
Right.
Right.
That's right. It's consistency, right?
Right,
It's
right.
minutes, it can be 5 minutes. It's compounded over time. And I was just talking to my mom the other day about that and how, if you don't feel like you're getting any stronger, well, then you're still able to walk from here to here in your house and have proper balance. It's the
Right.
maintenance of what you have because it's just kind of a morbid thought, but we're just degenerating, right? Once we hit 30, we're maxed out on collagen. Women, we're maxed out on bone density. And unless we continue to lose it, forgive the cliche, we lose it. And so it doesn't take much time, but the consistency, I'm proud of your dad for doing his exercise
Yeah.
consistently, my mom for doing hers consistently. And I think we may be talking directly to them as well as the other viewers right now, because they might be watching live. And I think that's so good because
Yeah.
we love them and we love people. And I want everyone who's watching this, young or old, to take that to heart. It doesn't take much, but it does take that consistency, that
Yeah.
habit to keep yourself where you are and enjoy your life to the fullest.
Yeah. I think if you had, we covered 3 main points, and if you have elderly family members in your life, or you're an elderly family person, if you can keep on top of your fluids, on top of your medications, and making sure you're taking them correctly, and talk with your doctor about, do I need to take all these medications? Is there any of these medications I can get rid of? And if you exercise on a regular basis, and it doesn't have to be a lot, that can do a huge amount. And as I use with my dad as an example, he's been good with his hydration. I'm all over his medications, and he's been doing his exercises. And this is a guy who was on a ventilator twice. He's on oxygen. I mean, he's done well for the past several years. And I think a big part of that were those being on top of those three things.
That's fantastic. That's fantastic. And there's one other thing though. I don't know if you saw the show from 2 weeks ago. I think you said Monica watched it on breathing.
Oh yeah. I
Yeah,
did. Monica talked to me about it though.
yeah.
Yeah.
So, I mean, a lot of people have reached out to me about the breathing thing and things they didn't know it could help. And I immediately thought of your dad because of breathing, because I was working with a patient who has severe asthma and I don't know, she maybe 70s.
Mhm.
And she had back pain. So I was working with her on breathing and I did the breathing for her back pain because when she got tired, she started having back spasms. Like when she got short of breath walking to the car, and it wasn't far. It was right from where your dad's chair is to the kitchen, not very far, like
Yeah.
for
Yeah.
the 40 feet about.
Mhm.
And she came back 1 week later and I said, "How are you doing?" And she said, "Well, I haven't had back spasms and I feel like I can take a deeper breath. So I want your dad to try some sort of breathing exercise. I need to call him on the weekend and try to get him and your mom to
Yeah,
try."
yeah, yeah, yeah,
I had my patient take 3 breaths because I
yeah,
said, just breathe. And then you breathe like you need to breathe. Let's just
yeah,
do a couple just for expansion
yeah, yeah.
and posture.
Yeah, sure. Well, you know, from experience with sports and certain types of sports in particular, breath holding while you're exerting yourself is poor for your performance. And the better that you can have relaxed and appropriate breathing, the better you do in sports. And it's the same thing when you're old. And the common situation is a person gets up from a chair or a bed and they walk to the bathroom. They do that multiple times out of the day. Statistically, that's what's going to get you. That's where you're going to fall, is between your bed and your bathroom, or your chair and your bathroom. And so that's exercise.
Yeah.
And the more you can focus on how well you're breathing, the better you're going to do. And if you're holding your breath, or if your posture is bad, you're bent way forward and you're pressing your lungs and your organs into your lungs, it's just you're going to perform poorly. And focusing on posture and breathing is as important to you and when you're 80 as is to when you're 18 and you're on a high school sports track field or something like that.
Yeah, no, it's such a good point. The perfect plug for me to talk about Mary Massery, who does all the breathing research and pioneered this thing in the physical therapy realm. She served disabled children and babies all the way up to the eldest elder. But I learned in her class we had to stand up and sit down, and we had to do a big exhale when we sit down, and then we had to hum or count out loud with a continuous sound like 1, 2, 3, 4, not 1, 2, 3, 4. Or you could hum, and I tried it with some people that couldn't get up from the chair, and it was amazing because it was regulating the pressure. The
Yeah,
breath hold just holds the pressure, right? But the regulating of the pressure, like that humming, when you stand up. So I always recommend for people that have trouble getting up from a chair to hum when they get up or
yeah,
count.
yeah, yeah, yeah. Well,
Counting's
I
hard.
think there's interesting. There's physiology in your lungs. When you make that noise, you're increasing the pressure in your lungs, and you're opening up the little air sacs in the deepest part of your lungs, and that's where the oxygen and carbon dioxide are exchanged with your blood. And if those lungs are collapsed because you're bent forward, or you're not breathing properly, you're cheating yourself out of that oxygen exchange. And as you get older, your muscles need a lot of oxygen, the maximal oxygen to work. Your muscles are lower mass, and it's amazingly fast how quickly they'll be deprived of oxygen and that strength. And you'll have people fall from weakness in their legs just because they don't have enough oxygen. And if you can improve your oxygen by just doing some things. Make sure your posture is appropriate. Maybe giving yourself a little extra pressure to keep those alveoli open while you're doing that process of walking, will save you from a fall.
I'm gonna use that. I'm gonna use that. I like that. That's a very good explanation, Bill. That's such a great explanation of the inside of the lung on what's happening when you're doing that. And I don't tend to talk about that with my patients, but I think it's important because you mentioned whatever you can say to someone that may get them to change that habit or improve their quality of life at home. I like that. The drinking more water because you need fluid in your pipe, in your vessels to do the humming or the counting or the deeper breathing or fix your posture because the alveoli in your lungs for people that have asthma or COPD or any other kind of obstructive or restrictive breathing, hearing that's their world is inhalers and breathing treatments and oxygen to because their alveoli aren't able to get filled with oxygen. Or post COVID, I did a lot of research last year on post COVID with coming out. If you were on a ventilator, as people were very early on, right, you're coming out and your lungs don't even work, and neither do your intercostals or your postural muscles, and all the problems that they are going to have afterward, just post vent, never mind post COVID or post pneumonia.
Yeah. I think the other thing that you'll find in older folks is they lose some of their confidence, And as they get older, they see their body, maybe losing strength, or they have a fall or a near miss, they lose confidence, and that breeds less effort, less chances or exercise or outgoing activities that are important, and you get in this cycle of depression, less activity, and more mobility, and it's just it's a vicious cycle. So I think when you have a strategy, or say, we have something we can work with. We're going to try to keep our hydration. We're going to work on our posture. We're going to be doing some techniques with our breathing. It's not only is it give you confidence that you can overcome this, but it's also a distraction too of the fear, that the thoughts and that's going in your head when you're thinking about this. No, I can do this. I can do this. I'm going to focus on my breathing rather than being fearful. And I think that works.
That's fantastic. So I do have a question from a viewer, and I didn't realize this happened this morning, but it sounds terrible. Tiger Woods was seriously injured in a rollover accident this morning. I hope he's okay. I didn't hear that. Are there different considerations when you treat an athlete in the ER? And we have 3 minutes to close, but I'm sad to hear that. I hope he's okay, but is there different considerations for someone who's like a high level athlete such as him versus me? Well, I'm a high level athlete too, but not like Tiger. Both are, right? We're aging athletes. But for someone who maybe is sedentary or someone who is younger, like I know we talked about this DMAT team, but we just have a couple minutes here. I just want to hear whatever you want to talk about.
Well, yeah, I mean, an athlete has more reserve, and so they'll be able to tolerate blood loss. They'll be able to tolerate lower oxygen levels, build up a certain electrolytes and chemicals in your blood. So you have more leeway. The body is not going to crash as fast as a newborn infant that has blood loss or electrolyte abnormalities, or an elderly person who has got pneumonia. They're going to crash pretty quick unless you jump on them with a very appropriate, very aggressive. Whereas an athlete, I'll give them the same care, but their bodies are going to help them. And the other thing that happens with athletes, and is it doesn't take too much time before they'll be off their game. And if Tiger is laid up for a day or two, he's going to notice a significant reduction in his capacity from where he was.
So we got to close, but I've loved the information that you shared with me and our families and the viewers, and about the athlete considerations too. That's very interesting. I will send Tiger a note with my business card so I can help him with his recovery. But I do hope he's well, and he's
I don't know anything that will happen.
I'm going to look it up right now. But thank you so much, Dr. Linders, for coming on and for sharing your knowledge. It was great to see you. Tell everyone hi, and thank you, ThinkTech Hawaii, for allowing us to be here in your homes with you today. Aloha, everyone.
Okay, bye-bye now.